The post-traumatic stress disorder, also known as PTSD, develops due to a specific stressor. It has been classified as an anxiety disorder and characterizes itself by the recall of memories which seem intrusive. Severe cases of PTSD force the individual to withdraw emotionally and suffer of hypervigilance and can conduct uncontrol of anger behaviors. This heightened autonomic arousal doesn't necessarily imply a better ability to feel positive emotions. Not being able to do so is known as anhedonia. Additionally, PTSD is frequently associated with the presence of depression, which may lead to drug abuse and uses with successful cognition. Regarding now to the ABCS symptoms, firstly, it's important to highlight the affective symptoms of PTSD. Anhedonia, emotional numbing, which means that emotions aren't expressed properly. Next, behavioral symptoms include hypervigilance, passivity, nightmares, intrusive memory, and exaggerated startle response. Also, cognitive symptoms involve the inability to concentrate and others already mentioned. The stress linked to PTSD results in somatic symptoms such as lower back pain, headaches, digestive problems, insomnia, and losing already acquired developmental skills. Moving on, for the treatment of PTSD, patients are often prescribed antidepressants, tranquilizers. These drugs are meant to regulate anxiety levels. Exposure therapy is a rising form of treatment along with the psychoeducation. This consists of teaching the patient about PTSD, then exposing them to the events which triggered the disorder through the exploration of memories. Traumatology is a field in psychology developed with the purpose of researching reactions to traumatic events. Group therapy is also commonly applied, yet results are under debate. Some arguing that it deals more harm than good. Testimonial psychotherapy focuses on deactivating networks of fear in the psyche. It also allows the patient to express what he feels and what the traumatizing was like, giving importance to the experience and leading to reflection. As a conclusion, we have ethical considerations in the treatment. When considering the cultural factors involved in the treatment of PTSD, one must not assume there is a norm in abnormal behavior. Non-Western alternatives of PTSD include symptoms usually not present in West alternatives of the disorder. Different people exhibit the disorder differently even within the same cultural context. Males and females, for example, differ in that males are more likely to externalize their problems while females are likely to internalize them. The causes of the trauma also lead to different manners in which the disorder is expressed. Sexual abuse won't lead to the same trauma as a war experience.
Depression is an affective disorder and is the most commonly diagnosed mental illness up to date. It can be diagnosed when the patient is having low moods, low self-esteem, a lack of motivation, and the patient mainly feels that he can never be happy again. So doctors don't really know what causes it, but they have found a lot of biological and cognitive and social cultural factors that influence a patient having depression. Depression can be treated through medications and different kinds of therapy. According to the ABCS way of categorizing symptoms, the symptoms for depression are, for the affective part, feelings of guilt, sadness, and anhedonia. Anhedonia is pretty much when someone doesn't have the ability to enjoy anything again. It's a lack of enjoyment of any kind of situation in their lives. For behavioral symptoms, we have passivity and lack of initiative. For cognitive, these involve negative thoughts, faulty attributions, like someone who's depressed can blame a relative's death on their own when it's not, so that's a faulty attribution. Low self-esteem, suicidal thoughts that can be very dangerous for the patient's well-being, hopelessness, difficulties concentrating, inability to make decisions. Now for the somatic symptoms, these involve loss of energy, insomnia or hypersomnia, extreme weight loss or weight gain, and a diminished libido. These symptoms usually interfere with this person's normal life activities and interpersonal relationships. Now, when treating depression, there are two main ways of doing so. Number one is supplying medication, and number two is psychotherapy, which involves different kind of group therapies, talk therapies, pretty much, and these need ethical considerations to be taken into account. These are basically six. Number one is an informed consent, that is letting the patient know what is happening, what is the treatment that they're getting, the fact that they can leave the therapy or the medication whenever they feel like it. It's just letting the patient know what's going on. Number 2 are external influences. This must really be taken into account by the psychologist or the psychiatrist treating the patient. For example, when a psychologist is treating a teenager that's in high school that is depressed, the psychologist needs to take into account that this kid, this teenager, is in a social ambience that is probably the one that has the most influence on this patient's behavior. So to an extent, this psychologist has to have a technique to manage this external influence. Number 3 is clinical innovation, and is when the patient knows of treatments that the therapist is not implying. And number 4 is a high-risk pharmacotherapy. This is very important because sometimes psychiatrists treat their patients with some medications that are high risk. In the case of some drugs that when they're taken in excess, patients can overdose and kill themselves on purpose or not on purpose, but the psychologist or psychiatrist has to have this in mind all the time, knowing the risk and knowing how to manage it. Knowing this patient's history, psychologists must know how to handle it to avoid a tragedy. Number 5 is having a difficult patient. People who are getting treatment from psychologists and psychiatrists, they're not always going there on their own will. Some are taken by their parents, or when society doesn't think they're suitable anymore for living in a community, they're forced to visit a psychologist or a psychiatrist. And these are the difficult patients because they don't want to get this treatment, they think they're fine, and they're going to reject anything that the psychologist or the psychiatrist, any help that they're trying to give this patient. So mainly when dealing with these patients, a psychologist or a psychiatrist must take into account that they must have a good communication with the patient and they must have a good relationship in order for it to work well, and that they don't want to make the patient feel attacked or something. And number 6 are therapeutic boundaries. The psychologist or psychiatrist has to know the extent to which he or she can influence the patient's life. The psychologist has to know when to stop giving advice and when should he be giving advice.
Hello, today we're going to be talking about anorexia, the symptoms, the causes, a brief explanation, the types of ways that the disorder can be managed, and the considerations. So, firstly, what is anorexia? Anorexia is a complex eating disorder with 3 key features, which are the first one, the refusal to maintain a healthy body weight. The second one, as it says right here, is an intense fear of gaining weight. And the third one is a distorted body image. So, moving on, there are types of anorexia. There are 2 types specifically. The first is the restricting type, which is when weight loss is achieved by restricting calories. And there is also the purging type, which is when weight loss is achieved by vomiting or using laxatives. So, moving on, there are several differences and several characteristics which make up anorexia. Firstly, there's a reduced appetite, followed by a complete aversion to eating. Then there is also, as I said before, a distorted body image and an exaggerated fear of becoming overweight. This is what leads most anorexic people to have several side effects, such as depression and anxiety. Now, we are going to examine the differences between dieting and anorexia as such, as is described right here. So, a healthy dieting is an attempt to control weight, while anorexia is an attempt to control your life and emotions, and has absolutely nothing to do with the desire to control weight, at least not directly. So now moving on to the signs and symptoms. There are several signs for anorexia or symptoms that can indicate. Firstly, there are risk factors, which is the tendency towards depression, a negative self-image, and the cultural bias of beauty, which all of these lead women or men to have anorexia. there are also symptoms which include severe weight loss. Now, the anorexic food behavior signs and symptoms are mainly there exists dieting despite being thin, which follows a severely restricted diet, which consists of only eating certain low-calorie foods. There is also an obsession with calories, fat, grams, and nutrition, pretending to eat or lying about eating, a preoccupation with food, and finally, there is also anorexic appearance and body image signs and symptoms. So the symptoms are mainly a dramatic weight loss, which is rapid and drastic, feeling fat despite being underweight. This is mainly a psychological problem which usually manifests in a conversation. There's also a fixation on body image, which means you are constantly looking in the mirror or constantly looking at yourself and you do not find yourself sufficiently appealing. They are harshly critical of appearance and the denial that you're too thin. Now, now relating to the purging symptoms of anorexia, which is the people who vomit to become thin, the symptoms are using diet pills, laxatives, or diuretics to promote vomiting, throwing up after eating, or compulsive exercising even if you don't want to. Now, there are cause and risk factors for anorexia, which are the family and social pressures, which might be present at the time, the biological causes of anorexia, which is when people tend to have high levels of cortisol, which is the hormone related to stress. And finally, we can see some of the effects of anorexia, which include severe mood swings, lack of energy and weakness, slow thinking, poor memory, tooth decay and gum damage, dizziness, fainting, and headaches, and the growth of fine hair all over the body and face. So, now we're going to be discussing types of ways to manage the disorder. So how do you get help for anorexia? You can mainly get help by admitting you have a problem. This is the first step. And then talking to someone. It can either be a family member or a psychologist. Now, there are many ways to treat these disorders, and usually these are called the eclectic approaches to treatment, which in some cases, when people are very, very sick or are diagnosed with a behavioral or a disorder, they are put under an eclectic approach to treatment, which means the psychiatrist or psychologist decides to implement several different therapies and several different methods all around the globe, from cognitive psychology and abnormal psychology, to attempt to help the patient. So this can be, for example, using not only drugs, but being able to use treatment, direct treatment, also speaking with the patients, questionnaires, having games, and then finally an approach with directly the doctor to manage the weight. So all of these approaches are put into one therapy at a time to help the patient recover faster. Now, there are also other ways to recover, which include staying away from people, places, and activities that trigger your obsession, as well as seeking professional help. So this is what I was talking about. You can either seek a professional help from a psychologist that uses many treatments, or from a psychologist that uses only one focused treatment, which could be either drugs or medicine, and also just speaking with the psychologist or psychiatrist. So the therapy, there are, as I said, medical treatment for anorexia, nutritional treatment for anorexia, which is visiting a nutritionist. There's also counseling and therapy for anorexia. Okay, so now we're going to be talking a bit about the ethical considerations of treatment, which include, first, putting the patient on top of everything. So this means that if the patient decides and wants to exit the therapy. However, you see there is a risk of them dying or suffering emotional or physical damage, you are obliged to help them until you feel it is safe enough for them to retire. However, the second consideration goes against this theory, and it says exactly that you have to respect the patient's beliefs, opinions, and religious approaches. So if a patient does not want to be in your office because he feels your religion disturbs him or offends him, you must suspend the treatment immediately. And finally, another ethical consideration which must be taken into account is if the patient is hurting the psychiatrist or the psychiatrist is hurting the patient. If either of these things happen, there is an unhealthy relationship, and with an unhealthy relationship, you cannot work a solution for the disorder, for any disorder at all. Now, it is important to note that there are also single therapies which are called cognitive therapies, and they consist of several mind exercises and brain control exercises which help convince the patient that whatever he or she has can and will be solved. By doing this, the brain starts reversing the ideas that it usually has when they have these disorders, and they are eradicated as soon as possible. Now, the use of cognitive therapy with the eclectic approaches to treatment, which means mixing all the therapies, can help the patient recover very fast. So today we learned about the brief explanation of the disorder anorexia, some of its symptoms and counter symptoms, some risk factors, as well as the types of ways to manage anorexia using eclectic approaches, single approaches, individualized approaches, and drugs or biological approaches if the problem is biological. And we also spoke about some of the ethical considerations of treating a patient with anorexia, depression, OCD, any of these disorders. Thank you.
Bulimia has been classified as an eating disorder and is most often present in women, though men are capable of developing it too. Bulimia, along with many other eating disorders, is believed to be most common in industrialized countries. It is usually caused by body dissatisfaction as a result of Western body image ideals. The symptoms of the disorder must occur at least 3 times a week for the disorder to be diagnosed as bulimia nervosa. Ego-dystonic behavior is known as the guilt and disgust patients report after experiencing the symptoms due to the lack of control of their body. Diagnosing bulimia doesn't rely on body image mainly because patients have an average BMI, body mass index. They look healthy pretty much. The ABCS. The symptoms expressed by those with bulimia nervosa are the following. The feeling of inadequacy, guilt, or shame are all affective symptoms. Recurring sessions of binge eating, then vomiting, or performing unhealthy amounts of exercise are all behavioral symptoms. Those who suffer from bulimia usually follow an undernourishing diet, which is only interrupted by the binge eating sessions. As for cognitive symptoms, patients often have a negative self-image, both morally and physically. They also have a tendency to perceive events as more stressful than most people would. Lastly, the somatic symptoms include swollen salivary glands from the consistent and excessive vomiting, erosion of tooth enamel, stomach or intestinal problems from the poor diet, and in extreme cases, they develop heart conditions. Now, there are several types of treatments for bulimia. Researchers are investigating for the most effective depression biomedical treatment, as this disorder is often linked to the development of bulimia nervosa. Bulimics often deny having a problem, and so providing treatment becomes a challenge. The most widely accepted and used therapy is the individual one. It addresses the cognitive aspects of bulimia, such as the affective and cognitive symptoms, with the objective of restoring eating control, avoiding dieting, as dieting is a trigger for eating disorders. The use of group therapy in treatment of eating disorders is a rising method. Participants are chosen to have similar characteristics in order for the group to get along well. The ethical considerations in diagnosis and treatment of bulimia nervosa are age, financial situation, cultural context, and severity of the disorder. Age matters in the sense that the patient may not possess enough mental maturity, and may hide key elements valuable for treatment and diagnosis. The treatment of eating disorders is an expensive one, and could lead to critical conditions worthy of hospitalization, which some may not afford. The frequency with which symptoms appear is a crucial factor when determining severity. Extreme cases are to be handled carefully in order not to upset the patient and lure them out of treatment.